Welcome, everyone. Thanks for joining us today. I want to welcome you to Preparing an AI-Ready Nursing Workforce, our webinar for today. This is our webinar series team. It takes a team to put on these events for you, and I want to thank everybody who puts in the time to make this happen. This webinar is hosted by Lecturio. If you would like to learn more about Lecturio, you can scan the QR code that's on your screen, or you can stay at the end of the webinar today to learn a little bit more about Lecturio and our ecosystem of learning. I'm your host today. My name is Sarah Keith. I'm the head of learning here at Lecturio, and I'm happy to welcome you today. And today, our guest speaker is Dr. Bonnie Clipper. I am so happy to welcome Dr. Clipper here today. She is a nurse futurist, a pioneer in virtual nursing, a nationally recognized thought leader in building cultures of innovation, and global speaker. She brings decades of executive leadership, operations, and knowledge of technology together to transform the national healthcare ecosystem. So, Dr. Clipper, I am happy to turn it over to you.
Thank you, Sarah. It's such a pleasure to be here with you and your team today. And this is one of my favorite topics, really talking about the intersection between artificial intelligence, nursing, the future nurses that we are in the process of creating, the nursing workforce, the nursing pipeline. I think there's so much to really think about in this space. So it's great to be here with everybody today. So thank you very much for that. I want to start a little bit by just having folks think about what does the current state look like for us from a nursing perspective? So when you think about the number of nurses that we have, I see that we're representing countries around the world, and this is probably a good time for me to say not only do I work here in the United States, I'm also a very proud resident of Portugal, so I do some stuff in Europe as well. And while there are some differences, there's a lot of similarities. So the turnover rate here in the United States is around 16% a year. And in Europe, it's similar, slightly less. When you think about the number of nurses that we are going to have to create around the world, the number is close to 350 to 400,000 nurses over the next several years that we're going to have to backfill. When you add to that the shortages that we are seeing of physicians around the world and even some of our other disciplines, there will just be insurmountable numbers of healthcare professionals that we have to train. Having said that, it's going to be incumbent upon us to think about how do we train and prepare nurses differently, and how do we practice nursing and provide patient care differently. We just don't have the luxury to afford doing it the same way that we've done it in the past. And that's where I think we have the ability to identify the promise of artificial intelligence. So just like everything, artificial intelligence is a tool. There are pros, there are cons, there are benefits, there are things that we have to really consider and figure out. But essentially, it's in a malleable phase where we can really think about how do we want to work with this. AI is basically a matter of looking at mathematic coding equations that focus on patterns, trends in the data, and looking at creating algorithms in a very real time learning kind of a way. So when we talk about large language models, these are commercially available. We all use them daily now. This is the ability to utilize something that's artificially intelligent, and it continues to learn not only from us about our personality, the way we write, our style, our thoughts, our philosophy. It also begins to learn from the data it consumes and it assimilates. So it's a continual learning model. When we think about what can we do with artificial intelligence in nursing, it can absolutely help support, not replace, but support us in terms of the clinical judgment, the problem solving, the thinking kind of work that we do, especially when it comes to assimilating information. So AI can be faster and more accurate than humans, but it should not be a replacement for humans. So there's one really great use case and one example that's been around now for several years, probably close to 7 to 8 years. And that is that we utilize artificial intelligence to read mammograms. And in fact, what we've seen over the years is that as these models have been trained, improved, and continue to learn, we now have such high accuracy in the 95+% range when AI is reading the mammograms, detecting for anomalies compared to a human being, a human radiologist. So in that case, what we see is not that we are replacing radiologists, but essentially the radiologist is the human in the loop. The radiologist is the one that is overseeing that system or that work, making sure that in fact there isn't something that has been done incorrectly or reviewed incorrectly by the AI, but rather that it is correct. So keeping the human in the loop is a way to change the role that we have as human beings as we assimilate more AI into our practice. When you think specifically about what artificial intelligence can do to assist us in nursing, my background is not coding or computer science. My background is operations and spending many years in evaluating technology, how we integrate and onboard technology to help us in hospitals and with practice. When I use this lens and look at what AI can do for us, you think about how nursing is such a busy role. It's also very task based. So when you think about it, we pull nurses in a million different directions. When things don't function properly, when something doesn't work properly, we say, let's give it to the nurse. This is where AI shows some promise for us. It shows promise in terms of reducing cognitive overload. Are there tasks or functions that nurses perform that AI can actually help us do better? So, when you think about reducing cognitive overload, reducing errors, think about the fact that we actually can utilize AI to review labs and vital signs and even look at nurses' notes, provider notes, and actually assist us by saying, here's what we think is going on with this patient as a result of the inputs, the labs, the vitals, the notes, the observations. That's stuff that reduces essentially the cognitive overload that nurses experience. These roles are a balance of task-based functions, many of which we could give away, and it also is a very cognitive function. It's us thinking and problem solving. The busier we create the environment for nursing practice, the more the chance for error increases. And in fact, we need the opposite. We need to reduce the opportunity for errors to make sure that bad things don't happen, not only to patients, but also for nurses. So this is one of those perfect opportunities. AI can also assist us in prioritizing care. So for example, looking at things such as making assignments, prioritizing care based on reviewing in an instant my patient's EHRs and helping me understand who's my most acute patient. Where should I begin my process of evaluating and or assessing my patients for the day? How should I prioritize my care for the day? So this is where AI can actually assist us. Also thinking about how we can utilize AI from a risk mitigation or deterioration alerts or notifications. And this is one of the true areas where I think AI is just going to be a star for us. When you think about a patient that could potentially become septic, wouldn't it be nice to know if that patient actually is preseptic? So we continue to back up the timeline and, in fact, intervene with that patient sooner so that we improve not only their odds of survival, but their outcomes. Also, from a selfish perspective, let's think about what that does for us from a time perspective. If we could intervene way back at the beginning, before we had a patient become a rapid response, before we had a patient deteriorate and have to call a code or have to send that patient off to the ICU, think for a minute about everything from a practice support perspective, what that does for us. Think about how much time and the resources and the mental capacity that's involved in managing a rapid response or managing a code or urgently or emergently sending a patient off to a critical care setting or even to an OR for a procedure. If we could back those things up, that gives us time back. It gives us the ability to slow-mo that whole role and say, if we were to do things differently, we actually would think about it and do things not quite so chaotically, but rather do it in a far more measured capacity. This is where I think that AI can really assist us. To do that, obviously, we have to have the ability to integrate the correct, the best, whatever that means in your organization, the right AI tools so that they do have access from a EHR perspective in a way that we can actually make them actionable. So identify the insights, don't over notify us, but instead give us a way so that we can care for that patient in the manner that's going to provide them with the best outcome. So when you actually drill down on that and begin to think about the use cases for this, a use case means something, what is the exact specific situation in which we would use AI? So today we're just going to touch on a couple of those. We talked a little bit about risk mitigation or deterioration alerts. Think about a risk detection and early warning notification. So we've had medical early warning systems, MEWS, for many years now. So imagine that ramped up on steroids. How does that change your practice when your use case is risk detection and early warning notifications? This means it's something whereas the EHR has the data, that's the source of truth. Our AI systems are scouring this data continuously and then popping up or giving the nurse, the direct care nurse, the actionable insight to say, here's an alert that we need you to think about. We can do color coding. We can do some visual cues that make these as sensical as they could be for us to really think about how do we process that information and how do we create action around that. We don't want to flood the nurse with too many notifications. We know from studying this for years, alarm fatigue is real, and we don't want to trigger that. That's actually a move backwards. So we want to think about how do we deploy early warning notifications through AI that help us save lives and improve outcomes. Another use case is something that you hear a lot about, and that's ambient documentation. And essentially what that means is that as we equip our rooms with cameras, speakers, and microphones, that AI is always listening. Now, this is a little creepy. It has a little bit of a big brother feel. So how do we create an environment where we want the AI to hear what we want it to hear at the times we want to hear it? And when it gathers that information, we also want it to have the ability to essentially help us create documentation. So help me write my notes, help me document on my patients. We know that about 33% of a nurse's shift is actually spent on documentation. Imagine cutting that back. Imagine giving a nurse 45 to 90 minutes back in their shift every day. How do we build a business case around ambient documentation, and what does that look like? We also want to think about not falling into the trap. And the trap, in my opinion, is we don't want to use tools that have been created for other purposes or talking about ambient documentation that has been created for physicians and just think we can start using it for nurses. Nursing practice is an entirely different discipline. We need to think about creating tools that are nurse-led and nurse-focused, not just retrofitting solutions to now focus on nursing. I think it gets a little confusing, and in my opinion, it's sometimes not the best move when we say we already have this tool for physicians, let's just turn it on for nurses. It's a little bit more complicated than that. Our practice is entirely different. I also want to talk for a minute about virtual care. Virtual care is something that is growing by leaps and bounds. It happens to be my area of expertise. And as we see this being deployed in more and more organizations, systems, hospitals around the US, and Europe is beginning to explore this as well, There clearly is the use to integrate AI into how we do this. And that's everything from harnessing or leveraging the technology. Again, it's typically camera, speakers, and microphones in the patient rooms. Let's use AI to tell us that a patient has been in one position too long. We also can trigger notifications that come from the AI to ask patients that are able to reposition themselves to avoid getting a pressure injury. We can also use the virtual care to assist us in caring for patients through the virtual nurse. So, just as I am talking to all of you through a computer today, virtual nurses are remote. It is a hybrid care model. So, we have the virtual nurse, we have a direct care nurse. We can certainly use AI to help both sides of that equation to drive smarter and better nursing practice. We also can think about deploying virtual assistants, and that doesn't mean a CNA or a PCT that is now remote, but rather, how do we create virtual assistants that can feed up very easily things that nurses need? We know we can create our own agents today. So if each nurse had their own agent, we can also make it a little fun and create kind of an avatar in a way that looks and feels like characteristics that engage us. But think about, how would I tap into my own virtual assistant to ask for side effects about medications, teaching strategies for a patient that doesn't want to do this or doesn't want to do that, yet has some physical limitations or restrictions following a procedure? How can I use the virtual assistant to tell me what I need to know about administering a new medication or troubleshooting a piece of equipment? So I think while this is something that shows promise, it also is a way for us to benefit as nurses in something that's very interesting and very helpful to us. I want to switch gears here a little bit and talk about the impact of AI. And sometimes it feels as though it should be obvious to us, but it requires us to dig a little bit deeper to really get a sense of impact. And one of the things that often comes up is, how do we create AI tools and systems that are specific to nursing needs? Because nursing needs are different than physician needs or provider needs. So when we talk about the impact of AI, we want to think about, it can offer us ways, avenues to provide safer and more accurate care. Think about when we all went to BCMA, barcode med administration. That for us was something that was a paradigm shift. It took us years to get the buy-in, to believe in the system, to have trust in the accuracy of the scanning and the documentation. And now we look at the fact that there are actually measures, quality measures from CMS, from Leapfrog, from Joint Commission, that take a look at how accurately, or the frequency in which we're scanning the patient's band compared to the frequency in which we're scanning our medications. Why do we do that? It's about making sure that we're administering the right medication to the right patient at the right time for the right reason. So it's about safer and more accurate care. The same thing is true with AI. We want to deploy it with the specific intention that it's going to improve what we're doing and improve the outcomes. We also have the ability, through artificial intelligence, to make our nursing jobs easier and simplify our workflows. However, what I want to really caution people about, and this is a conversation that I have with hospital CEOs on a fairly regular basis, is when you adopt AI, it can make your nursing staff more efficient. That does not mean it's the time to actually cut back on nursing staff, but rather let's improve the care that we deliver. And let's make sure that our patients are getting not only the care they deserve, but are getting care that helps their care plan be more efficient. So when we talk about efficiency, generally speaking, we have tremendous opportunities with length of stay. We have tremendous opportunities with avoiding over ordering or duplication of tests, and sometimes even polypharmacy. So is there an opportunity to improve the efficiency of the care that we provide? I believe AI is going to help us do that, particularly when it comes to looking at medications, treatments, even imaging or studies. Think about how frequently a patient comes in and has had an x-ray or a lab, even within the last 4, 6, 8 weeks. We redraw it. Sometimes it's incredibly important to do that. Other times it could be a bit redundant. So I think this is where AI is just going to provoke our thinking and give us some new guardrails. We also have the ability to use artificial intelligence to help us increase the access to patient care. So when you think about it, we're still learning a whole lot about the outcomes of artificial intelligence. Yet every week there are more studies that are published that let us know of the positive outcomes, as well as sometimes there are negative outcomes where we still have to go back to the drawing board and figure out how to tweak our models. There's a couple things that I actually came across in the last couple of weeks that I thought were fascinating. And one of them is a study that came out of Kaiser Permanente. And in fact, what they've studied was 3 million patient interactions through their AI chatbots. And they saw 96%, almost 97% accuracy in interpretation of what the patient entered and how the chatbot responded, and almost a 98% accuracy in directing that patient to the right kind of provider for follow up. 3 million patients is not an insignificant number of interactions. So when you think about the impact of these kinds of uses of AI, it continues to improve at a rapid, rapid rate. That's where we're really going to see the benefit. You think about this and tie this in with the workforce. There are literally shortages in every discipline, in almost every single organization across the United States and across the global economy of healthcare. If we were able to supplement some of our gaps in human beings with AI, I wonder how we would be able to start to close some of these gaps. This allows us to pull the humans up to practice at the top of their license, while perhaps asking some of these questions or reviewing some of these documents that are very redundant for us in healthcare. How do we make that easier for the providers and for the nurses? This is really where I think we have a sweet spot. I also think that helps tie things together with access of care. Now, while it sounds like there's a tremendous promise with AI in healthcare, I absolutely believe there is. I think what this means, though, is that we also need to think about what to be aware of, what to be concerned of, what to consider as we implement. And some of those things are really high level things, higher order thinking for us. We need to think about the ethical use of artificial intelligence. We need to think about how these models were created. Were they created with a baked in bias, or are they a non-biased ethical system that has been curated and generated? So I'll give you an example. About 15 years ago, as AI was continuing to be tested and developed, there is a study about a carcinoma, a malignant melanoma detection AI tool. And in fact, this tool had pretty good accuracy. So it was utilized on patients in a study, and they were finding better and better accuracy as the tool continued to learn. However, there was an issue. When they used the tool, and it was a scanning device, when they used it on people of color, the accuracy plummeted. And what they learned is that when they went back into how the model was created, it was created and tested on Caucasian patients. So while that seems obvious to us today, that was a huge aha moment to make sure that we are testing and building models that represent everyone, because it's so important not only that we think about something as simple as skin color on patients, we also need to think about gender, location, age. We have to think about all of this so that we create these models, particularly in healthcare, to be as safe and non-biased as possible. We also need to really apply principles around AI. And I know the American Nurses Association has done some really nice work around creating guardrails for the ethical use of artificial intelligence. There's also a very good position statement that has come out recently from the American Academy of Nursing. So it's important to think about looking for those documents, position statements, or ethical use statements as you begin to build your own practice, whether in your university, your school of nursing, your hospital or health system, to really think about what's an appropriate use case and how do you go about creating that responsibly. Also, think about privacy. Everything we do in artificial intelligence goes somewhere. It's saved in some kind of a database. What are the protections of that database? How is that data stored? How is it secured? Who gets to review that data? Just recently, there was an article published that said everything that we enter into Claude, Copilot, and ChatGPT could literally be used against us if we committed a crime. So we need to think about everything that we enter. Someone else is going to see that. It's going to remain, there's going to be evidence of that. So there are privacy concerns around the data. We also need to think about when we're looking at artificial intelligence, and again, I'm a hospital operator, so coming out of 20 plus years as a chief nursing officer, it's important that we actually think about what is it we're trying to solve for and change the model first and then integrate the technology to support us in that change. So often I see the opposite. I see organizations where a CIO or a CTO or even a CNO goes to a trade show and sees something amazing and they get a demo, and we all know what happens when you demo, right? You're really interested in the product. However, you really just need to pause to think about, does this solve a problem that's important to us? Because that's what, those are products we want to go after. Those are relationships we want to curate and think about how that actually helps us improve something in our organization that's a priority for us. So in doing that, we want to make sure that we create a new model. We redesign the way that we educate. We redesign the way that we care for patients, and we integrate technology in that. Technology, artificial intelligence alone is not going to solve our challenges. So we need to think about, this is kind of a twofer. It's really around redesigning or reimagining the way that we do it through the model or the framework, and then supplementing or integrating technology into that. We also need to think about preparing the nursing workforce for AI. So what does that mean? It means we need to think about educating and developing our faculty. It means that we need to think about how do we educate our current School of Nursing faculty around the world to understand not only what AI is, we also want to understand what we can do with it, how we want to prepare our students to learn to work in a world that AI is just there. It's going to be everywhere. So we need to think about that. Just like we need to think about educating our nursing students today, when they graduate, they literally are graduating in a world that virtual care is already in almost 40% of our hospitals. So how do we begin to think about teaching nursing students how to practice when there's eyes in the sky on the television set, or somebody is listening when they need mentoring on demand? So we need to think about changing the way that we educate. We want to teach not only faculty, but we also want to teach students and certainly incumbent nurses, what is AI? How is it used? How is it created? And we want them to help us bake it into the workflows. So some of that means we need to reset the way that we onboard new nurses. May need that we completely need to reset nursing education. We know that we have to focus on change management, because change management is something that we all have an opportunity to certainly do every day, all the time. And I would even submit that when we adopt new technologies or change our care, change the way we educate, the biggest impediment is always change management and overcoming existing paradigms. So change management is a huge part of this. What's going to be interesting is that AI not only shows a lot of promise, it's also going to create a plethora of new roles for us in nursing. We are going to see new roles around AI enhanced simulation instructors. We're going to see AI project managers, probably specific to nursing and nursing workflows, AI and nursing informatics specialists. We know that informatics as a profession continues to grow. It's incredibly important for us. We're going to see AI nurse informaticists. And I believe that's an area that's going to grow very quickly. AI ethics and policy advisors, clinical decision support specialists that focus on AI tools, AI assisted workflow coordinators. So I think there are a lot of different roles that are going to emerge. So this is a very positive for us. It certainly is going to help us shift some things around, and there are some new roles that will begin to emerge. From a concern or a consideration perspective, I think in my opinion, this is where we really need to be very cognizant about de-skilling and dependence. So we see probably every 6 months there's another article that comes out that talks about how we as human beings are losing some of our problem solving or critical thinking skills because we're already beginning to rely on the existing AI tools to help us write an executive summary, create a business plan, create a spreadsheet, compare two or three different things and write a summary. It's an amazing tool. However, what happens to this muscle when we don't flex it? Over time, we create a dependence and we risk the long term dumbing down of critical thinking about across human nurses. And I think that's a risk. The same way that we see downtime procedures in hospitals when the EHR goes down, our younger nurses that are not used to documenting on paper or on those 6-page double-sided ICU spreadsheets, we see them go into panic mode. The same thing could be possible with AI. We risk de-skilling and dependence, and that's something that we have to really be able to plan for. Ethical concerns, we talked a little bit about that. And then certainly we need to think about the error and the bias that is created in AI world that provides us the opportunity as the human in the loop to step up and lead in that scenario. So that's something to be very mindful of. It's another concern that I have that we need to think about how we frame the utilization of AI. And right off the bat, the target is not always let's do something with fewer FTEs, fewer nurses, fewer educators, and instead just use AI more. This is a real mixed bag. And AI does not have the cognitive nor the compassion or empathy we need to create a fully robust picture yet. Someday it may, it does not today, and it's very likely not going to the next year or the year after that. So we really need to think about how do we create tools that create cognitive bandwidth for nurses to practice safer, to educate smarter, to do a better job, and use that time much more effectively. So I'm going to end with a question that I am asked frequently. And the question, if you follow me on LinkedIn, and I hope that you do, every couple of months, you will see me go into full alpha dog mode on this because I will have a company reach out to me to look at their AI nurse. There is no such thing as an AI nurse. A nurse is a protected term around a human that takes specific education to obtain licensure or registration. So there is no such thing as an AI nurse. Is AI going to replace nurses? Not today. In the future, I think I've probably watched enough of the Jetsons and Star Trek to think it's very possible in the very far future. I do not see that in the next several many years. I also think this is where nursing is very, very unique. Essentially, just like delivery services like to see themselves as the last mile of delivery, I believe nurses are the last mile of healthcare. We are the connection, we are the human and empathetic connection between what care we're going to provide and the patient that is a human being that deserves the care and the compassion that we can render to give them that care. So I think from a nursing perspective, we're the last mile of healthcare. And I think it's important for us to continue to think about ourselves in that way. We need to be involved in the development of tools, the creation of models, but it's very important for us to think about the fact that we're completely necessary in this equation. Sarah, I am going to open it to you and see if we actually have any questions.
Thank you so much, Bonnie. That I always love hearing you speak about the future of nursing and where you think all of this is going. Yeah, we do have a few questions, and so I can share those with you. And as a reminder to those of you who are joining us here today, you have a great opportunity to ask Dr. Clipper any questions you might have about AI, about the future of nursing. We definitely want your questions. This is an interactive portion of the webinar, so please put your questions in the Q&A box or in the chat, and we will ask those during this part of the session. So I wanted to ask about one of the things you talked about was ambient documentation, and I'm curious about how let's think about this as a teaching use case. So how do you teach nursing students to narrate care for ambient documentation? And then the flip side of that, how do you teach a brand new nursing student what to do when the system goes down, to use those analog systems?
Yeah, two great questions. So, from a nursing perspective, we're different than physicians when it comes to ambient documentation. Physicians have been using a phone or using a device to essentially dictate their care for 25 years. Actually, I'm going to even say 35 years, right? Um, Probably longer. So it was very common practice for a surgeon after a procedure to pick up a phone and actually just dictate what they did during that case. There's a couple reasons for that. On the back end, usually for quite the longest time was someone that actually wore a headset and typed it out, and then some of us remember it would be printed on paper. Those people with the funny little rubbery things on their fingers came around with stacks of them, flipped through them, put them in the right patient's chart to make sure that the notes made it from the dictation through the transcriptionist into the patient chart. What was unique about that was that that's what we did for physicians to make sure that their note showed up in the chart. It's a joint commission requirement to have a note, so we wanted to be really good at that. And this is how physicians bill. So, for a physician to bill, we needed to think about getting the right words because we know that the right words are connected to the right billing codes, which make a huge difference, not only in hospital billing world, but in physician billing world. So, physicians got very good at talking through the care they've provided or the procedures that they've done. And in fact, this is taught it's taught in medical school, it's taught in residency. They learn this from day one. In nursing, this is not a skill that we're taught. We do not learn how to narrate the care that we're providing or the assessment that we're looking at. So when you think about utilizing the same type of an ambient documentation tool, it's great for physicians. In nursing world, I've listened to some of these recordings and literally nurses just babble on and on and on because we're not trained what specifically to do from a review of systems perspective and then what that means. The other things is that some of our documentation is a mismatch. When we do our assessment, some of it is checkbox, drop down box, depending on do you use Meditech, Cerner, Epic, whatever that might be. So we have to figure out, is it that I'm saying what the skin turgor is, choice A, choice B, choice C, like my flow sheets, or am I saying something else? So it's a huge opportunity for us to teach nurses not only to narrate their care, but to narrate it properly, which means get to the point, clarity and brevity, words that have to be teased out. I also believe this could potentially down the road set us up as a way to bill for nursing services. If we're using the same kind of keywords and code words, just like physicians use, does it open that door? I don't know. But I think for us, it's a great opportunity to figure out how do we train a skill that we've not had in nursing, and then how do we change the way we practice? Now, from the other side of this, when we go from digital to analog, this is where sometimes it's funny to me. I was in a hospital just a couple months ago, and they had to go to downtime procedures, and the new nurses literally were freaking out because they did not know about some of these forms and how to use them because they never had to. So when we go from digital to analog, we have to make sure well in advance that nurses know how to use these systems and what to do with this. So if you think about it, Sarah, if we're in an ambient documentation world and we're documenting our assessment, our interaction with patients, our patient education, we also need to know the inverse of that. We need to know how to do it on the appropriate documentation, or what do we do when the system goes down? So we certainly have to teach both of those, the backup plan and the primary plan. We need to understand both of them, and they have to be baked into our workflows.
Absolutely. I appreciate your focus on clarity and brevity and efficiency, which and thoroughness, which would surely benefit both sides of that. Uh, we have another question that's about AI, perhaps not relieving burnout, but perhaps contributing to burnout. So the question is, isn't there a danger that adding AI will diminish nurses using their own critical thinking and the possibility of hospitals hiring fewer nurses, using those 45 minutes freed up by AI to require them to do more of something else, perhaps leading to even more burnout?
This is a fantastic question. And I think whoever wrote this really clearly articulated several of the pitfalls that we have. And that is, as we're able to utilize AI and it frees up chunks of time throughout the course of a nurse's shift, does that mean if I save 45 minutes for nurse A, 45 minutes for nurse B, 45 minutes for nurse C, 45 minutes for nurse D, and 45 minutes for nurse E, do I just get rid of one nurse because now I've just expanded their capacity? So this is something that we have to be very, very careful with. And again, in my opinion, today, I don't see us changing our care delivery mechanism because the other supports are not all there. We have to do this all together. Now, do I think there's a point in time that we get there? I hate to say it, but I do. I do see this partially because we're hundreds of thousands of nurses short around the world, and partially because we're going to have to redesign the role. Currently, the way nursing is, there are so many tasks baked into nursing because nursing does them. We get them done. Are those the appropriate things for nurses to be doing? I don't know. This is where every organization is going to have to evaluate the tasks. I do see a day that we have fewer nurses that are sort of the supercharged thinkers, problem solvers, coordinators, and more task-based people that are also involved in that. Our care models are not there today, but I absolutely believe we will get there. And again, this is not Bonnie saying we are replacing nurses with AI. I do not see it in the next couple of years. I do see it in, I would venture to say we're going to see staffing change in probably 5 or so years. That does not mean that people should run out and retire in 5 years. It basically means we need to think about how do we own our profession and what are we going to do differently with this technology. Between artificial intelligence and virtual care, yes, we have opportunities to do things differently.
Excellent. So thinking along those lines, uh, I think this is a problem that educators in many fields are facing right now, but particularly in nursing. What are some best practices you could suggest for training nursing students for those AI-enabled roles that might not even exist yet?
Yeah, this is sort of us, um, building the plane while we're flying it, right? I think we're going to see these roles pop up and be developed. We're going to then have to create job descriptions. And then when you go backwards, certainly we're going to have to educate people, whether that's, formal education through master's, through bachelor's degrees. I think we're going to create a completely different crop of nurses. So yeah, it's my belief that we have to make sure that nurses that are still in nursing school understand artificial intelligence and virtual care models. And I think the world in which they practice is going to be different. Is that a bad thing? No, it's a different thing. It means that we're going to have to prepare them for potentially very, very different roles that they're going to fill.
Yeah. We also have a question about individualized patient care plans. Do you think that AI can help RN and nursing students create individualized patient care plans?
100%. It's doing it today. So we really need to lean into the skills that we're doing and we're doing well. And essentially, when you think about it, AI, while it's invisible, it sort of acts like a little bit of a creeper in your EHR, and it can pull things faster and more accurately than we as humans can. So it literally can go back and look at an admission. It can look at all of the notes and identify at this point in a patient's care trajectory what makes the most sense for a care plan and sort of spit them out and tee them up for us. That's the stuff that we should be using AI to help. Then when we get those care plans, it's still up to us to implement and put all those practices into place and then to evaluate it and to make sure that we're seeing the outcomes we expect to see.
And one of the things you mentioned was owning the profession, nurses owning the profession. And I know that we have many of the folks on this call who are faculty and administrators and leaders in their field. So, how can nurses be part of these developing solutions?
Yeah, this is, for me, this is one of the topics that I feel the most passionate about. Nursing is ours to own. We right now are in a little bit of this valley where there's an awful lot of anger and apathy. And what's happening is that we essentially are empowering technology companies to just own our profession because they're selling tools that say we're fixing nursing, making you more efficient, making you smarter, making you safer. It's kind of a crock of bowl. So it's up to us to create the processes, the frameworks, the practice, the models, and own our profession and fit the technology solutions into that. We run the risk if even if we don't like where technology is going to take us, even if we don't believe AI plays a role, even if we do not want to work in a facility that has virtual care, the challenge is that horse left the barn many years ago. It's too late. If that's what we believe as a profession, we will be completely irrelevant, which means there will be something else that pops up to be the closest person to the patient, and it won't be nurses. So if we don't figure out how to get in the game and how to come up with a game plan and how to own this, we are on a fast track to irrelevance. And that's true whether you're an educator or you're a nurse or you're a leader.
Thank you. So, speaking to those educators who are on the call, what would you tell them about preparing a workforce that's ready for nursing alongside AI from the day they begin?
That's a great question, Sarah. I think we want people to understand, particularly nursing students, what AI does, how it works. With your clinical partners, please expose your nursing students to that when it's utilized in the EHR, whether it's care plans, whether it's early warning alerts. We need to expose nursing students to that. Also, virtual care. Work with a technology partner to get virtual care into your sim lab so that you can at least teach your students what it looks like in that environment. You should not have a virtual care nurse that has less than 3 to 5 years of experience. So that's not new grads. However, new grads are certainly going to be practicing with people like us on the television screen, talking to them and their patient. So as a nurse, what do I do with that? I shouldn't be threatened. I don't want to be passive aggressive. Instead, I want to learn how do I communicate in a three-way conversation with the TV set? What does that mean? How do I use that person to help me when I want to call them in for a second opinion because I'm concerned I'm going to have to call a rapid response? How do I pull them into a conversation with a patient that I'm struggling with? How do I use them as precepting or mentoring on demand? How do I use someone like that through the course of virtual care to help me with dual nurse verification of meds? So these are the kind of things that we need to be teaching in nursing school. So when these nurses get out and start practicing, they're not caught off guard, they're not surprised, but rather they can just fit right into it.
Excellent. Thank you so much, Bonnie. I really appreciate all of your uh, information you shared with us today, your vision for where nursing is going as a profession, answering questions from our participants today. This has been a fantastic conversation, and I really appreciate you sharing with us. Thank you.
It's always a pleasure, Sarah, to be with you. And I would encourage anyone that wants to get into the conversations that I have on LinkedIn, please feel free to follow me there.
Thank you so much. And for everybody who's joining us today, I want to thank you also for spending some time with us. If you would like to learn a little bit more about Lecturio, that's who's putting on this webinar today. And so if you'd like to see a demo that is personalized to you, you can use that QR code on your screen to schedule a demo. So once again, I want to thank Dr. Clipper and all of you who are here today. And I'm going to, also I want to share with you, we have another event coming up very quickly that I need to let you know about. So before that, I want to talk to you. We have a learning ecosystem here with Lecturio. We have several different ways for you to learn, and one of them is a Simtix, and that offers some lo-fi simulations that you can use for nursing students. If you're interested in that, again, there's a QR code on your screen. You can learn a little bit more. We also have Healer, which is a clinical reasoning platform. This is excellent for nurse practitioners, anyone who needs to practice their clinical reasoning skills. So you can use the QR code on your screen to learn a little bit more about that. I also want to let you know we have another webinar next week, and I am happy to welcome Jamie Fairclough from Pilot to Practice, Building an AI-Ready Institution, and that will focus more on institutional readiness. So I'd love to have you join us for that as well. So we appreciate your time today and hope to see you at our next webinar. Thank you.